Hey guys, it's Dr. Greer and Dr. Gallus will be joining me in a minute and we're going to talk about hand rejuvenation. And you're probably going to have a cat. There he is. Yep, you're going to have a cat butt in a sec. And there it goes. He's fun that way. He'll probably knock over a plant at some point too. All right. And then we'll look for Dr. Gallus. See if she is on. The cat is literally right next to my phone.
Oh, hello.
Good. How are you?
How's it going? Oh, I guess.
Oh, yeah. I just
Gallus.
invited both.
Whatever.
I didn't know what you'd be under.
That's okay. My middle daughter broke her phone again while we were in Hawaii, and so she was using mine. And now when I log on, since she used mine, there's like 18,000 accounts on Instagram logged in because all the teenagers have like 4 Instagram accounts.
Oh,
it's ridiculous.
Okay. I guess I'm boring. I have like 2.
I know. It's accounts where you can follow people, secret accounts, private accounts. Yeah.
Yeah. I'm not that cool.
Yeah. For sure.
How was Hawaii?
Yeah, I'm not that cool either. So,
yeah,
it was good. It was really nice. It was relaxing. The weather was beautiful because it's always beautiful there. And nice. It was just chill. So, now I'm back. I had a killer week in the OR last week because that's what happens when you get back from vacation. And
somebody from Denver is watching. Hi. I went to Denver once.
Oh, cool.
Nice.
I've been to Denver.
Yeah.
I've been skiing out there. Also, not Denver, obviously. Cool. So,
yeah.
Hand rejuvenation. Yeah. Yours are definitely younger than mine and look
only because I laser them all the time.
All right, well, let's start with laser. What do you
I do BBL on my hands, but then I'll get like, have you ever seen the really flat seborrheic keratoses? And they're hard to tell, like from a solar lentigo, but I've had a couple of those off that I've done ablative spot laser on too. And it worked really well. The only thing I warn patients is the scar stays pink for like 6 months. It stays pink forever.
Oh, yeah. For the seborrheic. Yeah. So the BBL,
yes, IPL, but it's this brand.
Yes. Okay, so it's intense pulse light. So for our audience, that generally targets pigment. Yeah. So I have an IPL. I've stacked it with fractionated CO2 on the hands. It's nice because it'll hit the pigment, and then it will also.
Hi, Amanda. How are you?
And then, so you use the BBL, so you use that pretty frequently. When you say frequently, like every day,
like
every
a couple
week,
times a
every
year.
month?
Nothing.
Okay. I feel like our personal goals would be to do something to your hands every month, but what ends up happening is it's
I feel like quarterly would be a really great goal for me to subscribe to, but nothing.
Because it takes like a hot second to do it,
long.
Right? Do you numb for that?
Although, I'm doing a Vivace radio frequency microneedling on my chest tomorrow. Maybe I'll just hit my hands too. Yeah.
Yeah, sure. Why not? Yeah. So and also I live in Southern California where, sun exposure is a thing. And so even if people take good care of their face, et cetera, it comes up all these areas that you maybe didn't pay such close attention to. Chest is probably number 1. Number 2 would be hands. And now I have people bugging me about the area right above their elbow.
And I always feel like hands are tough because chest, you can put sunscreen on. Hands, you put sunscreen on, you wash them an hour later. And it's hard to keep the little, like I've noticed just being outside, I have more freckles on my hands now that are popping up. It's annoying.
Yeah, I feel like unless you're a proponent of the riding glove or driving glove, you're not, which I do have a couple of those patients, which props. So they have little driving gloves in their car and they put them on so that that's most exposure. For a while, I tried to keep Super Goop. They make a hand screen. So it's hand lotion with sunscreen in it in the car. So I would remember to do it, but I am just not that attentive. So. But yeah, so we do IPL, but we have the Roar fractionated CO2 laser, and it actually has a box attached to the side of it, and you disconnect the laser that you would normally do, face whatever with, and you attach it to this box, and you put your hand in the box, and it fractionated CO2 lasers in hand. It's amazing. Fun. Yeah. And so that also only takes a few minutes. I don't numb for it. Most people don't need to numb for it. And then it thickens the skin on the back of your hand. And it's not as great at pigment, obviously, because IPL, that's why I've stacked it for people before. But it definitely works. So much so that I did my right hand 3 times, like when we first got it, and didn't do anything to my left hand, just so you could see like the effect. And it's definitely, you can see the veins in my hand were much, everything was, the quality of the skin was totally different. Skin tone. Skin tone? Darker skin tones?
Because IPL is tricky on darker skin tones. You can do fractionated laser though, and that will help build collagen. If there's a lot of pigmentation changes, you can do a very cautious BBL.
I would say fractionated CO2 because you can do this. The hand skin can take it pretty well, and you can do a lower setting because we've played with that as well. But yeah, so I've done that, and I'm actually prone to hyperpigmentation, and I didn't have any like post-inflammatory hyperpigmentation. And I do pre-treat my skin, my face, if I'm going to CO2. But with the hand, no, and it had no issues.
Nice.
I did not.
Yeah, we have fractionated erbium. Yeah, so, that's what the Cyton has. But then if we're doing a halo peel on the face too, we can also do the hands. And the halo's got dual wavelengths, so it does the fractionated, and then it does a fractionated deeper layer, so that's really good for uneven pigmentation, and that would be great for darker skin tones too.
Yep. Yeah. So yeah, I love the laser for the hands. You just have the CO2 leaves it scratchy for about a week to 10 days. It just seems like kind of like a cat's tongue. It's feels like sandpaper, and you keep it extra moisturized and, stay out of the sun if you can.
And try not to use hand sanitizer a bunch.
I did. Oh yeah. But I've scrubbed with it and I haven't, it's fine. It's not like CO2 on the face or anything. Yeah. So, and then I am looking at doing it to like upper arms, that area over your elbow. I did CO2 to someone's anterior thighs today.
Fun. So for that crepiness.
We'll see how she. Yeah, for that crepey skin. So you can do you have Vivace and I have the Virtue, but basically radio frequency microneedling. You can do both of those to improve laxity too. So yeah, there's really no reason you couldn't do that to
it just starts to get prohibitively time consuming if you're like trying to do your entire anterior thigh or like the entire inside of your arm. It's a lot.
Oh yeah, for sure. Yeah, you kind of want to break that up. But the hands are easy to throw in there. Anything to stimulate collagen and thicken the skin on the hands is going to help.
Yes, and then when they get thin and you can see all the tendons, then we start adding filler or fat grafting.
Right. So what is your
I've been using Radiesse for hands.
For the hand.
Which is nice, especially since it's the 1.5 cc syringe and it spreads out so nice and evenly. So that's nice for volume. I know some people do Renuva, which is the fat, like the processed sterilized fat. What do you like?
I've done both of those.
Do you ever do lift? I should try it though. I have a lot of lift.
Yeah, I like Radius. Do you do one
I do one
syringe
per
and
hand.
just split it, or
Yeah.
do you do one syringe and yeah. So I like to hyper dilute the Radius, and then, well, not hyper
Like
dilute,
1 to 1.
dilute it a little bit more, and then use that. Yeah, because when you put the 1.5 syringes of Radius, it's like injecting
Yeah,
chalk
very
into someone's
stiff, and then
hand,
you really have to
honestly.
spread it out and work it in.
Yeah, and massage it. So I think originally when I was trained on it years ago, they
Yeah,
had
to
the
like warm it
patient
up and
sit
then
on
you
their
massage it
hands,
out.
right?
That.
Yeah. But then I was like, or I could just dilute it a little bit,
Yeah.
and then it's not so painful to do that. And then do you do a
I
cannula, or
don't.
do
I
you
just do the needle. I'm
injection?
not a cannula person.
Same. So yeah, I just do the needle. And so yeah, we're talking about a filler that is supposed to also stimulate collagen. So not only is it adding volume, but it should theoretically continue to stimulate collagen. I have Radius in my hands right now, actually, from, I don't know, a couple months ago. And then I've used Renuva. The verdict is still out on that on a patient. She's very skinny, so I don't know if it's because she doesn't have a lot of fat, because it's a scaffolding, so you're not really adding volume, you're adding this sterilize somebody else's fat scaffolding in there, and then your body's supposed to come in and put fat. And I've had it work with like a BBL, like a supercharged BBL, where we weren't doing a ton, so taking someone's fat and mixing it with the Renuva and then putting it in, and that's worked really well. But in the hands, I just injected into the hands, and it's sort of like, and I asked, the company again about it,
Yes.
and Usha, who does it a lot, and she's like, "Oh, you
How
just need to
does
do
that
another
compare
round."
price-wise
like,
to Radius? Yeah.
It's expensive. So it's about, for 1.5 cc's, it comes in 1.5 and 3, and I feel like it's $3,000 and $5,000. So it's expensive, and then to have to do it
compared to
again.
Radius is like
However,
$725, $750. Yeah.
Right. Yeah. So and you have to wait 3 to 6 months for the results. So I'm waiting to see how that is helpful to anybody. I know. I was excited because it seemed like a good alternative. Certainly if it's more permanent than a filler, that would be nice.
Work and you drop $3,000.
Right?
That's not real fun. People love that.
I know, that's not ideal. I can't see a difference. Oh, really? Let me see. Oh, yeah.
Cat.
Fine. Yeah.
Cat tail. Cat head.
My dog is sleeping.
This is my massive cat.
Couch.
She's like 16 pounds.
Oh, yeah.
Really, cat?
Oh my gosh.
He just knocked over my water. He just like flopped his big old butt right down. You can come back. You're fine. Hilarious.
Oh, you can see my dog in the background.
He's
Someone's
like,
sick cat. Oh my goodness. Where's the cat? Okay, so yeah, so I have not used Lift personally, but you can use it.
Higher
it's a
G prime,
hyaluronic acid, right?
Bigger projection, it's more stiff. It's like more structurally supportive. It interests me so much that we use all these stiffer high G prime fillers for the hands. Like Radius is so stiff, I normally use it cheekbones. And hands just strike me as thin skin, and yet that's what's FDA approved.
Yeah, that's true. Like you'd think you'd want something softer.
Or like a contour,
like a
nice and fluffy, the wrestling contour.
Well, wrestling contour, they probably just didn't feel like doing studies to show
I'll have to ask around, though, and see if anyone's using that in the hands, because it's nice, big, fluffy particles, but the prime, so it's softer.
Mm-hmm. I just think if you're going to use a product, I feel like Radius is going to last longer, right? So, and then the other one that I don't have any experience with, but I bet someone's injecting. Why wouldn't you inject?
I was actually just questioning that myself. Like, you could. I mean, I don't think it's mobile enough where it's going to form like nodules.
No, if you hyper dilute it, like, couldn't you just put it in? And it should last just as long. and just massage. I guess maybe just the massaging part post-operatively, it should work.
Yeah. I know these are the fun things we
whatever.
question ourselves. We're like, can I inject this here? Try it.
Where can I put this? Why hasn't somebody tried this yet? Why isn't this the... Maybe because I really feel like Radius is effective, and I think it'll last longer. The only reason we don't use Radius all over the face is that it's not reversible.
Well, it is stiff too. I don't like it in smile lines. I feel like it's way too stiff.
Yeah, I only put it basically in the cheeks. Yeah, jawline's nice too, actually. Somewhere deep, but not superficial. I have tried it in the neck for neck lines. Hyperdilute.
Yeah, I've tried hyperdilute in upper arms. I mean, you could tell it built some collagen, but it didn't look amazing.
Yeah, I have used it successfully in the area above the knee, which is slightly different skin, so that worked. But again, it's supposed to be biostimulatory and stimulating collagen, so maybe that's what's really happening.
Yeah, it's hard to know. So many different fillers that vary just a little bit.
Yeah. I mean, that's all I have.
Yeah, there's not a ton we do for those, really.
Lasers and fillers. There's no hand.
Maybe we should make that up. Did you ever see the show The League, about a fantasy football league? There was a plastic surgeon on there who specialized in like toe shortening. That was his thing. He would like shorten your long second toe. And I was like, I need a really niche procedure like that. Like maybe earlobe tucks. Those are fun.
Yeah. Those are fun. I know. I notice, but that's something that unless a patient notices, you don't want to bring up. But on some of my older patients,
big, y'all.
Like,
we can just it's so fun. It's just like a little snip.
Yep.
And then your ear turkey again. It's good. Do it in the office.
Yeah, and if your earrings are like sagging, that's it's dragging on the ear.
It does.
Totally
your lips get bigger. They continue to grow.
For sure. Yes. But somehow the skin on your hands does not. So I'm not aware of any wrist lift.
No. I still can't believe you have a box you just stick your whole hand in. That's fun. Does it do the fingers too, really or just
Yeah, it'll go all the way. I mean, literally, it shows a grid and it just goes across, and it's on a piece of reinforced plastic. So if it in between, it's not hurting anything. It's hitting that plastic. Yeah. People are always like, what else can I put in there? I'm like, that's a weird question, but you could stick your whole arm through it.
I remember when I was in residency, I rotated with a dermatologist who did a lot of cosmetic derm. Like I remember she was on one of the Latisse commercials, and she had like fraxeled her entire arms multiple times. They looked amazing, but it was like, God, that would take forever.
Yeah. I know. That's the thing is, yeah, you could do that, but it's sort of like Kim Kardashian had a post earlier this week on where she was getting, was it Morpheus? She was getting basically, because she spelt it wrong, which I thought was hilarious. Sorry. Like, she was getting that done to her anterior abdomen, which I've done the Virtue for that. You just put numbing, the cooling jet, and just do that. I have had a handful of patients who wanted that. It just tightens the skin up a little bit, but it really is for people who have time and and you're like, oh, I know what could use. I'm thinking, oh, I should do that, but again, I can barely get around in my face.
I know. So, I'm like, my chest is getting like just the little vertical lines, when you wake up and it's been all smushed all night. So I'm like, okay, I should really do that. And then I was going to do my second treatment last week. Did I do it? No. So I'm doing it tomorrow. It's just like something else always comes up.
Right. Yeah. And then you're like, oh, I'll do it next week. And then it's 3 weeks later.
I wonder what would happen if you did PRP injection 100%. Into the hands. See, again, things like, where can I inject that?
Why can't we inject that in there?
We got the centrifuge. We're doing PRP now. Yeah, we're going to do an under-eye rehab and inject it, then Vivace, then topical. I'm excited.
Nice. We did under eye PRP a couple weeks ago with my OR team because they had the centrifuge. And besides, I had a black eye because I was teaching my nurse how to inject it. But other than that, the other eye looked amazing right away. Yeah. It was nice. Yeah. So what PRP kit are you using?
No, we got a kit. We got like the ProGen, I think. Yeah, and it comes with the centrifuge. So
okay.
It's just in our office. It's fun. Right. We can just grab blood, spin it down, and inject it in the office.
Yeah. And we were also doing it with the Virtue, with the microneedling. So you put it on and then stamp it in at the end. Yeah. It was nice. People looked, the youngest person to have it done, our OR tech, looked freaking amazing by that. Like, she was done first, and by the time the afternoon was ready, was finished, I had a black eye, and she looked like she was glowing.
Well, and all these things too, cool. It's like it takes time to see the results. And it's kind of frustrating for patients because they're like, well, I just did this and nothing. I mean, I had a halo peel in April, and now my skin looks amazing. But, you know, yeah, that was like 3 months ago. And now everybody's like, your skin looks fantastic. I'm like, yeah, 3 months ago, I did a halo.
Right. Right. I know. It's being patient. Oh, well. Okay. I mean, we can do that. Yeah, we'll have to talk
maybe
more
that should be our next
stuff.
one. I might have to do some more research, though. Yeah. I know. We should do that for hair loss, too. Who am I thinking do I see injecting it for hair loss all the time?
I don't, but it's definitely, I tell people that's the one area where there has been some literature to support hair growth. So it's supposed to be pretty effective for that. But I feel like I can't, like if you're already doing a treatment, if you're already doing radiofrequency microneedling, why wouldn't you just then additionally stamp the PRP in if you have it? Like, it can't hurt. It has to
and it's so
it
easy.
Better, you know? So
I'll just be bathing in it. It'll be fine.
Yeah. That sounds about right. All right. Well, maybe we'll talk about PRP in a couple weeks, or I don't know. Is there another surgical procedure that anybody's
or that we haven't talked about in a while? I mean, I love all breast.
I'm doing a massive weight loss breast lift this week, so we'll see.
Yeah, I saw that earlier. You were asking like the.
I mean, I definitely am going to use lateral breast tissue because you don't want to. She has a lateral roll. I'm not going to throw that away, so I'm going to rotate that up. It's just whether I do a superior medial pedicle or an inferior. Whatever that other
I do on those. I do superior medial pedicle, and then I leave the breast tissue on the inferior pedicle and free it up, and then tuck it up under. What is that? The Ribeiro technique?
Right.
Yeah, and that really nice upper pole fullness.
Right. It's just then where do you rotate?
Well,
you rotate
the patients
lateral
I've done that on didn't have a lot of lateral. So, yeah. Because it's nice if you can pull that in and make breasts out of it.
Yeah. Yeah, because she doesn't have a ton of volume, so it'll really, I'm not, we don't like to throw things away as plastic surgeons.
Yeah, how do you bring that in? But then if there's an inferior pedicle, how do you bring that lateral in? Wouldn't the inferior pedicle just get...
They almost do like a central mound and bring everything up and around, kind of like take the breast tissue off, and then it's the spiral or something comes around.
That's fun.
It's just I'm so used to doing superior pedicles.
Yeah, this is the fun part of plastic surgery, is like the three-dimensional visualization of where can I take that and then tuck it here.
Yes.
And it's crazy. Like, we just think of crazy stuff and lay awake at night, which reminds me, have you read the book The Facemaker by Lindsay Fitzharris? It just came out. Oh my gosh, they were doing the craziest stuff, and we're talking like 1916, and they're like doing these amazing facial reconstructions, but it would be like 25 stages.
Right. Yes. I did read that. It was incredible. I also thought, wow, a lot of these.
Right, but they were like doing pedicles, like transfers, like based on lateral pedicles here, and they'd like take all of the skin on the chest. But what was blowing my mind is then they took skin grafts from just random people and put that on. Like, that doesn't really work.
I know. I was like, I know they were just making stuff up. It was crazy.
Yeah.
Yeah,
Plastic
a
surgery
lot
is
of it
amazing
worked.
that way. But I loved at the end of the book. So this guy, pioneer of plastic surgery, and then he did a phalloplasty. He did a female to male transgender surgery. And we're talking like 1940, 1950.
Right. Yeah.
Yeah,
He's
I
like,
make a
"Huh, what
penis.
else
Let
can
me
I
think
do?"
on that.
He loved to check. Yeah, that was a great book. It was really incredible. And it was for people who aren't plastic surgeons.
And the pictures at the end are just incredible. Did you read her other book, The Butchering Art? So good.
No,
it was about the onset of sterile technique and like antisepsis in the 1870s, because people would just die from compound fractures, and then they discovered carbolic acid would kill the germs. So it's about Lister. It's fascinating though, because that was before they had anesthesia. At least for World War I, they had ether and they were knocking these people out. But then it was like, how fast can I amputate this leg? Let's do a minute. And then I don't know how they got hemostasis. They didn't have cautery. They weren't like clamping time. I think they were just like wrapping it up and hoping for the best.
I know. Yeah, it is kind of insane what they did. I guess it's, necessity, right? You don't have an alternative, but it is kind of bananas. And it's slightly depressing that it's a catch up to modern, or at that time, modern warfare, right? So like weapons of destruction advance faster than our ability to clean up after it.
Although now our ability to like preserve life. Well, I mean, you were in the Navy, so you were actually deployed, but it's kind of crazy how they can pack people up, stabilize them, ship them, and then they have these major reconstructive surgeries in like Germany, and then you get somebody back who has like no arms, no legs, and no eyesight, and it's like, I don't know, was that good?
I know. Right. Yeah. There's the ability to resuscitate, because we're moving so far forward, means that people who would have never survived tend to survive. But yeah, definitely.
I'm gonna hit all the deep ethical questions tonight, now that it's like 8:57. But I'm here.
Now that we've covered hand rejuvenation. Wildly variable.
So we'll do it again.
All right, cool. All right, well, we'll come up with some sort of surgical procedure for next time. All right.
You too. Bye.